Let's just review what Dr. Bickman talked about. It used to be called the insulin resistance syndrome. Now in America it's called the metabolic syndrome. Increasing risk for heart disease, high cholesterol, high blood pressure, type 2 diabetes, Alzheimer's dementia, many cancers, PCOS, fatty liver disease, which we'll talk about later today, kidney disease, which is not listed on here, and the list goes on and on. This is a graph of the number of patients in our country who are getting diagnosed with diabetes over time. And this ended in 2010. The numbers continue to go up at an alarming rate, almost exponentially in our country. Carbohydrate addiction is the biggest reason. It is a real thing. We talk about it a lot in clinic, don't we? We have to recognize that it is a problem. It's such a problem that some of you, even when you look at this picture, it stimulates your brain to think certain things or your body to do certain things. You eat sugar, you like it, and then you crave it. Sugar has addictive properties. Number 2, as your blood sugar levels spike, dopamine is released. This is the same dopamine that is released with drugs or other addictive behaviors like pornography or such. When insulin is secreted when a high sugar load comes up, our blood sugar drops quickly. And in number 3, it says as blood sugar levels fall, because of this high insulin, the sugar goes into our fat cells, so it gets out of our bloodstream very quickly. And our brain says, what? Where did the stimulus go? I want more. So number 4 happens. Our blood sugar drops, our appetite goes up, our cravings go up, and the cycle is repeated. Who remembers this guy? Remember, the raccoon is our carb cravings, right? He will come, and he will come. But remember the analogy. If you stop feeding the raccoon, it will go away. I am convinced that those of us who just say, I'm done, I'm not going to allow myself sugar, I'm not going to allow myself cheat days, I'm just going to stop the raccoon from coming, the cravings can go away. Now, I'm also convinced that it's a lot easier said than done, because dopamine is so powerful. I hope you'll all remember this slide. I've posted it on GroupMe once before, but there are so many natural ways to increase dopamine naturally. If you expect to be able to go home after a day of work and sit on the couch and watch TV and be able to get away from carb cravings without doing anything else, eventually the raccoon is going to win. You have to be exercising or moving daily. Good quality sleep is so important to restore the hormones in our brain. We have to eliminate sugars as well as processed oils. Any of these processed vegetable oils can stimulate sugar cravings. Early morning sunlight. So many studies have shown that if we wake up and get outside within that first half hour of waking and get sun on our eyes even for 10 minutes, that will stimulate natural dopamine. Protein-rich foods actually can stimulate dopamine at a healthy level. Uplifting music, reducing stress, again, easier said than done. But here's the challenge I give to myself and to my patients. There are some stressors in life that are just going to happen. And there are some stressors in life that we have control over, that we've allowed to be a part of our lives, and we need to decrease those stressors. Building and strengthening healthy relationships. Even being here as a group of like-minded individuals can strengthen our dopamine levels. Assuring proper gut health. I wrote down probiotics, that is one, fiber is another. And then cold water. It's a big thing now, people doing cold water plunges or ice plunges or cold showers, but actually it does stimulate dopamine. There's a lot of studies on that. So if you're having cravings for some ice cream, go jump in a lake and it'll go away. Jump in a cold shower. All right, a couple slides from Lindsay from last year about stall slayer. So a lot of us, if not all of us, will come upon a stall in our progress, whether it's a stall in our weight, a stall in our insulin resistance, a stall in our blood sugar levels. First of all, you have to ask yourself, is it really a stall, or is it just part of the process? It's so important to keep track of measurements, more than just your weight. I'm a fan of impedance scales of some kind. Also understanding that your body composition could change. If you lose 2 pounds of fat but gain 2 pounds of muscle, that's a win-win in my opinion, even though the scale doesn't show it. However, if you go many months without a change, that's officially a stall. And even if you have stalled, if you're using those healthy behaviors, there's still good things happening on the inside. And when we check your blood, we can see that. So this is something that we see a lot in patients who have done the process, maybe even gotten into remission, and then carb creep happens. You're strict at the beginning, but you start letting things slide a little bit. Now, let's be honest, as your body heals, you are able to tolerate more healthy carbohydrates easier than you were in the past. However, processed carbohydrates, very, very difficult. And some people are even sensitive to sugar alcohols. So your erythritol, that is a sweetener in a lot of things, that can be a trigger for you. And just remember, net carbs is created by the food industry and is a marketing ploy. I remind you, do not go off of a math equation to tell you that your food is healthy. Net carbs is not good to go by. Okay, here's some slides by Michael Mendenhall. If you remember Michael from last year, one of the pioneers of this area of putting his diabetes into remission, talking about relapse. Relapse does occur, the falling off the wagon, so to speak. Here's some myths. Number one, if you have a relapse, it's a sign of failure. False. If you relapse, it's a sign of poor motivation. False. It just means you're human. Relapse starts the moment you take the first bite of something bad. False, because you can always stop yourself. Next myth. Relapse is unpredictable and unavoidable. It hits you out of the blue. That's also false. Once we understand what our triggers are, we can prevent that. A relapse cancels out all progress up to that point. It is not 1 step forward and 2 steps back. It's vice versa. 2 steps forward and 1 step back. That's okay. And if a relapse isn't the end of recovery, then it's okay to allow myself to have one. That's a lie that we tell ourselves. It's okay if I have a cheat day. No, that's not true. And then just some recovery tips that he gave us. This is from, if any of you haven't gone to the website, Food Addiction Reset, ARC. It's a very good website if you're struggling with food addiction. They have a whole program that you can sign up for. But here's some tips that they share. Manage your stress, manage your cues for food eating, and manage your triggers for unhealthy eating. Also, think about it that this is a slow and steady process. Yes, we talk about elimination, but we're going for the long haul, not for 2 weeks or 2 months, but for years. And then lastly is practicing self-care, making sure you're taking time for yourself throughout the week and throughout the month. Okay, Richard Bird is one of my friends, and I'm just going to give you some advice that he shared.